Welcome, Harriet, to the Essential Implementation Podcast. Um, you're a leading researcher at Deakin University's Institute of Physical Activity and Nutrition. And I think, is it fair to say you've been tackling probably one of the toughest challenges in public health, which is, how to take interventions that work, maybe they've been shown to work in small trials, and make them effective, sustainable, and equitable at scale. And that's something you've been thinking about. Is that fair to say?
Yes, I think I've tried to take a really big picture view of all research and career and started really big and gone with how do you make the whole world improve by one small thing. So it's not an easy area, but yeah, I think that's pretty accurate.
Yeah, yeah, yeah. Well, I mean, and what kind of sparked your interest
Mm.
in scaling up? What kind of started that interest?
That probably emerged really from working in the NHS. So I did my PhD on a physical activity intervention, and it was in the real world, but it was my PhD was around evaluating it. But actually left academia and spent a year in the NHS, and it was a very short amount of time. And I, don't wouldn't claim to understand the inner workings of the NHS, but my job at the time was to evaluate something that was being rolled out. Effectively, it was being scaled across the health service. And it was just phenomenal to me in sort of a very naive, graduate way that I sort of thought, oh, surely this evidence-based thing that had been developed probably from an academic institution just couldn't be delivered. And the barriers were phenomenal. And the smallest of things meant it just wouldn't get traction. And so that to me was the initial realization that wow, this is ridiculous that we just sort of can pass these interventions across to settings and that's it. And this was 2012, quite aware. We've moved on along a lot since then in terms of our knowledge, but I then returned to academia with that was my focus. So I wanted to study implementation science, but in the same breath of the experience of how implementation was overlooked, increasingly I just became aware that the exact same issue was happening with scaling. So I lost count of papers that would end on an effective or an efficacious intervention, and they would conclude that it's now potentially scalable, or it is scalable, or we want to scale it. And it was that I think just feeling of how many assumptions we're making this, and on what basis are you assuming it's even possibly scalable? And I just think, yeah, it was I was fortunate. I considered the time in the NHS to be completely the a pivotal turning point in my career for having that real world sort of experience. But it was really from then that I just felt this is really oversimplified, and huge assumptions made on what can be scaled, how we do it, and whether we should do it, more importantly.
Yeah, it's kind of like this kind of idea that we've done it here, so we can do it the same everywhere else. And I think you became aware of that, and also aware of just trying to do it in one
Mm.
place was hard enough, but trying to upscale it was even harder. Yeah,
Yeah, 100%. And it's not really academics' jobs either. I think that's the other thing. I think possibly we conclude with those points because when it's not really a university's job to fund scaling of something. So we possibly do end up saying, oh, and it will be scaled by someone else, at some point, without maybe knowing exactly what that's going to look like and if it's even possible.
yeah. I do think it's our because this is really interesting, isn't it? This area, but do you think it's our role to understand how to implement something and maybe how to
Mm.
scale it? Um, or
It's tricky. I mean, look, I'm of the view that scaling is a science in and of itself. So if you take that perspective, then there is certainly a role for researchers and scientists to be trying to understand that. If you don't see it as that and it's more of an act, then I think that's where it becomes in the realm of a government or a non-government organization or some external funder. And that's where I think it might be perceived that it's their job to figure the how. We've done the science, you figure the implementation and the how. So I guess it's which sort of side of the fence you maybe sit on it. My view is that, and I say this from experience as well of working with interventions where we've tried to scale them, that actually the reality is stakeholders or actors working in governments, they haven't got the capacity or
Mm.
time to actually spend understanding the depth that we possibly think's needed to understand it. And so really, I think it's possibly better suited to scientists to try and study what might affect or inhibit it or enable it. But ultimately, it's the external organisations in these settings and communities that have to do the doing. That's beyond, I think, the the university's place in the pathway of scaling, I guess.
Yeah, I think maybe there's a way we all, for these sorts of problems, we all need to work together, as a whole across the system.
Yeah.
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 Yeah. Well, so that sparked your interest. You went back to university. You started focusing on scaling. So what then happened?
I think it just became increasingly apparent that we don't really know how to scale. And I think this is, as I say this, not to undermine all the work that's been done to provide guides and resources to scaling, which I've contributed to. So I say this in acknowledgement of the limitations of my own things I've produced, but that they're very they're sort of almost idealistic in a set of recommendations. And they're true. So there's evidence underpinning all the recommendations. If you want to work across sectors, or you want to do this, you want to have a plan and strategies, X, Y, Z, all good stuff. I think where the experience of having been involved in interventions that are trying to be scaled is the reality of it is so much more complex, and actually some of those recommendations can have an unintended outcome too, and that's often not captured in some of those sort of resources that support scaling. And so I think that kind of shifted me then to take more of a complexity sort of view of it and systems thinking. And I've often, when I've talked to people about systems thinking or systems approach to scaling, I actually believe more of us are thinking this way than get labeled. I think most people probably don't say I'm taking a systems approach or thinking, but people really are, in my experience anyway. And so I think when I realized that's actually what we had been doing in our group or individuals had been doing, we'd never called ourselves doing that. It just makes sense to me, a systems perspective on it. I don't know if it's the solution to anything. We're all just trying to figure this out. But I think a combination of oversimplifying scaling, that it's incredibly difficult and time consuming and complex, that a systems perspective is the only viewpoint I've read and got involved in where it starts to make more sense to me.
Yeah. And I mean, could you build on what a systems approach or systems thinking means to you? I know you've talked about interventions being events in systems, and we'll talk about systems oriented scale up. So that's obviously what's come from that. But what does it mean to you?
Yeah. I think to me it's reorientating your perspective about scaling, just the whole concept of scaling. So predominantly scaling is understood to be an innovation, a program or a policy, and it's widening its reach. And there's a really basic, the fundamentals of scaling. That is what it is. That's sort of the backbone to expansion, right? Whereas how I try and see it, and I guess what we advocate in this system sort of orientated approach, is that you actually begin by considering the broader system. So rather than starting with your program and how do we get more people doing it or having more of an impact, it's actually understanding the system you're trying to change. Because really, if you're talking systemic change or sustainable, equitable, like real population shifts, you're really requiring that level. And I think what we've seen so consistently over time in public health is just this difficulty of replication of anything across many different complex settings. So when the way I would see a systems orientated approach is that you begin by understanding the system to start with, the behaviors of that system and what might be necessary or needed to influence that system, and what might occur positively and negatively. And from that can then inform what type of change, might not be a programmatic change, but a change that needs to occur to get a better health outcome. So it's almost a reverse of what the sort of more traditional conventional approaches to scaling, I'd say.
Yeah, because I guess we see there is this kind of force, I suppose, running through science where we not all the time. I think it's balanced by other forces, but this kind of reductionist, mechanistic, logical approach to things, and that is seemed to be. And I mean, it was very refreshing and nice to hear someone mention pilotitis at the implementation conference a few months back now, where this is why I invited you after seeing your talk. But you mentioned, I think you mentioned pilotitis then. We just keep we do pilots, we find something's effective, but then it sort of seems to end there, and it's very difficult to take things further. And I do think you're onto something, because I remember I mentioned to you Laura Darmschroeder was one of the guests on here, and she's been on a couple of times, and I think the last time she said it's very important to call a thing a thing. So she was saying it's not been going so well in terms of actual implementation outcomes, but she said maybe we're focusing our attention in the wrong place. And from what you're saying here is that actually you're saying, let's look at the system first, and then see what we see there, and then think about what change to bring about. So I've seen a few frameworks talk about leveraging, pulling different levers of a system, but how do you go about doing that? What does that look like?
Yeah. I mean, there's a few things to unpack there. I mean, I think to my knowledge, there's no gold standard way of identifying a leverage point, and that's something, you know, system scientists are still trying to sort of figure out. I think we often apply, or I try and apply in my projects, like systems analysis methods, but particularly more of the qualitative ones, because a leverage point is just a place of potential influence. So, you know, it's just somewhere that may be of interest to try and maybe do something, right, in sort of basic terms. And qualitative methods where you're talking to individuals across a system, so multiple different levels of a system who have different levels within their particular organization or in their particular sort of setting, their perspectives on the problem and how, you know, solutions might evolve within that particular system they work in. That's where you can tease out leverage points. So we've done things like group model building. We've done interviews where we've extracted that information and tried to put it in a map. And then we ask those individuals, now you can see the map, because it's conceptually quite difficult to see, you know, individuals' experiences. It's their mental models. They can identify where there might be places of leverage. So I think that's the kind of an approach we tend to take, is actually working with the individuals in the system itself. I fully sympathize and understand why that sort of linear reductionist approach has taken a lot in scaling. I know it's been heavily criticized in public health in general, is how we look at public health problems, but with scaling in particular, it's so expensive and over such a long time frame, decades often, that the really reductionist way of looking at it makes it so much easier for us to study it, and we can systematically break it down into parts. But I think that makes it very difficult to identify those places of leverage, like you've just said. So we're in a system, of an academic system, that encourages to conduct science and behave and be and study things in a certain way to make it something we can study and appeal to funders, etc. And I think that's often in conflict with what we really need to be understanding of a whole system and where we might want to intervene. And it's probably too much off on a tangent to get into that, but I think it's almost to acknowledge that we all fit within systems ourselves that are inhibiting change, and it's not just outside of us that you make scaling or implementation so difficult, but we're also part of the problem as well. We're in it too.
Yes, I agree. It's quite a tangent, but I mean, it's definitely been a thread in this podcast as well, and that, you know, we had Professor Johan Fazy quite a while back talk about climate change, and his argument was, you know, the reason why we haven't solved things like climate change is we need practical knowledge, and we generate a lot of theoretical knowledge. And I think also, you know, in implementation science as well, as some of us feel perhaps it's been very weighted in the theoretical side of things and less in the needs of practice. And so I mean, you know, it's probably, I'd love to have you back talk about it, because but I always think, you know, maybe we need to, it's the methods we use. We can help that by using methods that actually help practice perhaps more than perhaps some more traditional methods. And it sounds a bit like you might have been going down that road a bit, because you're talking about qualitative approaches, which with people across the whole system. So, I mean, perhaps to go on from this, if it feels right, but you talk about systems-oriented scale as a complement of traditional methods. So what, could you just build on that example of that a bit more?
Yes. Well, Harry Russo, who was involved in that work, we purposely articulated that it's a complement, because what we don't want this to become an academic debate where, are you doing linear intervention orientated scaling, or are you doing like it's not sort of the purpose of what we were trying to do. And so we sort of articulated that it sits on a spectrum. So it's just another way. And if there's one thing we know about scaling, is there is no one right way to do it. So it's just an alternative way of thinking. And I think with the systems orientated scaling, we sort of encourage that you'd use systems analysis methods potentially, that there'd be some sort of understanding of the bigger system that you're trying to influence, as opposed to just the program. It all sits on that pathway. You still need to understand your intervention. There still needs to be evidence behind it. But I think it's just zooming out from thinking that we just need to push something into a system and that will work. For example, a school-based intervention, enforcing it into an education system, as opposed to understanding the education system to start with and where there are challenges or opportunities, and then thinking what an intervention might look like. That's, I think, the difference.
Yeah, I mean, that just, to me, it sounds so on point, really. I mean, yeah, because I mean, just from my own work, I've seen that again and again and again. We develop something, even it might even be free or cost less, but it still comes up against system barriers. And I think you talked about the needs of, I think we mentioned earlier, people, one of the biggest barriers, people don't have time to problem solve the implementation over time. And so that's something that, yeah, I see it in the NHS. We are implementing things at rocket speed all the time into a system that's very full. Let's maybe look at the system first. Yeah. Because I know, I mean, Penelope Hoare, a big fan of hers, and she talked about events in systems that implemented. Then I think you've spoken about that. And interestingly, you did a 2024, I think it was 2024 review. I'll flash it up on the screen for people. It's really good. Yeah. You actually found that systems approaches are still rarely applied, really, in non-communicable diseases that you were looking at. But yeah, they're not applied that much. Why do you think that the adoption of these approaches are so limited?
It is interesting because most in that particular review, and this was interventions targeting NCD risk factors, behavioral risk factors, most of them had acknowledged that successful scaling had to lead to sort of a system change, but yet a minority, like less than 20%, led to a system and adopted a systems approach. So there's a sort of conflict in what we want to achieve versus how we do it. I think one of the issues was it's not very clear in scaling how to actually operationalize a systems approach to scaling. That's a sort of gap that I think I'm very cognizant of after leaving off on the why a systems approach to scaling can be beneficial. Is then you need to sort of provide some way of, really like clearly and transparently showing examples of what that can look like. So it's the operationalizing of it is challenging. The other element was we found was it's really unclear reporting. So there were interventions that had adopted theory, or they had some influence at a systems level, but the way it was described was really, really fragmented and just really difficult to get a sense of what they did, how they achieved what they achieved. And I'm sure in part that's to do with the focus of the paper and the limits on words and all of, and if you were to interview those individuals, you'd be able to get more information, but it just contributes to this culmination of that we just have so many unknowns. So I think my feeling is when I talk to people is that we all agree that this can make some sense. We all want to have a population level impact, but the real how do we literally do this with this particular health problem or program that we've already got, but we want to, take a systems perspective? That's really difficult. And things like system change, it's how do we measure that? I don't know the answers, and capturing that and how long it might take for a policymaker or a funder. That can be really problematic, I think, trying to sell them to invest in something, but that could be decades before we'd see a change. So I think some of the realities of doing it is still unclear in, the practical steps of what it would look like, I think.
Yeah, it's quite a shift. I as well, it's almost like a big paradigm shift, I think, in how we think.
I was going to say, and I agree, I think with this concept of scaling being an event in the system, I think it's so difficult because to continue receiving funding for an intervention of some sort, you obviously need to demonstrate it's having some impact. Now, in scaling, for example, that you could be having phenomenal impact on the belief systems of implementers in whichever setting you're targeting. So they may now have shifted their perspective of the problem. They maybe have built capacity amongst their teams to be skilled up in X, Y, Z, so they can actually deliver what they're doing better. That's sort of compartmentalized as slightly separate then to that intervention impacting a health behavior. So if you cannot demonstrate that impact, it becomes very difficult to get sustained funding and things get defunded. If a government changes, then they often defund the previous government to not continue that work, etc. And so I don't know that until we have a broader way of recognizing and actually appreciate is not the right word, but really validating those other impacts of scaling. And I'm going to just use an intervention. It's the easiest one to conceptualize. It's going to be, I think, very difficult for us to take a broader systems perspective, because all of the work I've done for the last 8 to 10 years consistently shows that scaling is really political. So, we constantly find that you could have something that has evidence, it's low cost, people like it, community support it, gets easily adopted, but it just, as soon as it hits that policy macro level, if there isn't buy-in there, it's just a brick wall and it's over. And the reverse, you could have all of those other factors that aren't present, but it's supported by policy and it will go to scale. And so I think that it's very difficult for us when we're trying to approach a health problem, and we maybe come from, if we're a behavioral interventionist, or practitioners often are required to fund things and outputs that you can only measure those sort of shorter range type of impacts, and they might still be over 5 years. It might not be incredibly short, but trying to influence or change policy level decision making, I mean, that could be phenomenally difficult, and it's beyond the scope of what a health behavioral scientist is what they're trying to do anyway. So we have these sort of two forces. So I think that sort of scaling aspect, the really political side of scaling, is, from a science perspective, very difficult for us to deal with. And I think even if you have all the ducks aligned, unfortunately, we are still within the realms of policy and these cycles of politicians that ultimately, because like I said earlier, academic institutions aren't funding this. You really need country level, like state, like federal governments often, to support these things, that it's far beyond the hands of the initial intervention developers and the types of metrics we're possibly capturing to show an impact on health. There's much more at play here that we don't have control over.
Well, you're speaking like somebody that's been paying attention to the whole system,
Yeah.
Yes, that's right, because I think it's very easy to sort of be in one area of it and kind of that's your world. And
yeah,
I mean, I agree with everything you're saying. I mean, the smaller something is, I've worked in very small businesses in the past, and much easier to bring about change and connect with the top. And when you get to these huge health systems, a lot harder. And actually, I don't know if you've ever, I'm sure you have, but if you interview, a nurse, or you interview a patient, okay, usually possible. But when you interview somebody sort of very high up the chain, like a CEO or a chief exec, not only is it hard to speak to them, but it's probably won't get as an open data as you might do, because so that's another. I don't know. That just came in my mind as you were talking there. But,
yeah. No, and I think it is. I fully agree. I mean, I'm doing a study at the moment where we're interviewing policymakers around the politics of scaling, essentially, and we've been fortunate that all of our participants have been very generous with their knowledge, but you have to. It's sort of understanding the boundaries of everybody works for an organization, and there's tensions there that that they feel and we sort of are aware of. But yeah, I just also think, like you were saying about like your experience in business, like making a small change, is there was a really interesting paper, and I wouldn't be able to recall it right on the spot now, that I read recently, and it was in a health service. I'm not sure if it's the NHS, but where they actually made a really small change within a particular department, and it had these phenomenal effects and long-term effects. And essentially the emphasis was that you can actually have big impacts with really small scale change as well. I think with scaling, and I could be guilty of this, is you sometimes like massive, like whole country, like millions of people, it gets very big, and it can be seen as very overwhelming and intimidating to people. But actually, that was a great paper and they said the same, like, why does everything always have to be sort of transformational systemic change? What about these really small, lots of accumulated small scale changes that actually really contribute? And I think that's a really important point as well, that if you do feel that your place in the puzzle isn't to be able to go all the way up to a macro level and understand that, that's okay. And I think, but understanding where you sit in the system and then your particular impact can be quite small scale, but it's the accumulation of all of those within the system, I think, is where we possibly have more impact, and people are more likely to maybe buy into these approaches. Like you said before, like what inhibits people, it's possibly also a feeling of overwhelm.
Yeah, it certainly feels like it would require everyone to work together, and I think that would
Yeah.
require good connection and communication between everyone.
Yeah.
I kind of think I had this theory in my head a lot, informational monism. It's this idea that everything's information.
Mm.
I'm not an expert, but even in a this might sound strange, but in a say a physical object like a table, if you zoomed
Yeah.
in enough, it would just be electrons, ones or zeros, and so now across a system, if information could flow really freely and everything's connected, a bit like a cell in a body, if that's going on,
Yes.
it's relationships are going on, it would function very well. I think
Yeah.
part of it is that we just, as humans as well, we're limited. Our attention is limited. The amount of information we can take on is limited. As you say, everybody's got is in a different perhaps area of the system. They have a different agenda, different needs. A lot of
Yeah.
people are burnt out, so that makes communication difficult. I wasn't planning on asking this, but do you think AI is something, isn't it? AI is something that can manage a lot more information than us. Do you think maybe that's got something to do with where we might go in the future with all this?
Oh my gosh.
I didn't.
I don't
Sorry.
know. I feel like it could go that way in the way AI is going. I mean, it would be really interesting to see how it does change how we interact.
Yeah.
Because even though, we know so much about siloed working and sectors not communicating with each other, and it's still very difficult. And even like, I can even think within in a university, there are schools that don't talk to, really talk to each other. So I don't know the answer to that, but I suspect that it's possibly going to bring us possibly. That's a hard question.
It is. I just think if you've got like even just two people in a close relationship, how well they relate to each other is very important, because it will determine how well they can overcome issues, the longevity, the meaningfulness of it, everything. That's just two people. And then you take a whole system and you think, if it's actually possible for that system to relate brilliantly well across every level, it would probably be an amazing system, right? So it's sort of, how is it? We're just not able to do that yet. And I think somehow one day we will probably get closer to it. But anyway, probably taking us on a bit of a crazy tangent there. But perhaps to bring us back to this right now, let's imagine we've got something that works then, shown to work. Perhaps an exercise intervention. That's something that you sort of have some expertise in. So how would we kind of already touched on this, but how would we design for system change rather than intervention fidelity? What might that look like?
Yeah. I think if you're designing for fidelity, if that's the word to use, I think there's potentially problematic when we're talking real world and scaling, because I tend to find that any sort of adaptation or change, whatever, is usually a positive thing. And the quicker you can get whoever's intended to be the owner, inverted commas, of this, be it in a community or an individual, an organization, to be able to modify it to suit their own, whatever their needs are or their agenda, that's much better for the long-term buy-in. But I think it's it's partly a shift in the individual that's designed the intervention. So I can think of an exercise type intervention in my mind as I'm saying this. And I think typically designed often by scientists who are coming from the perspective that it's prescriptive. So you need X amount of certain thing to lead to a certain health outcome, be it like a reduction in falls or an increase in something. And there are quite tight parameters around that. And it can be to some extent quite black and white in terms of this is the dose. There is a dose response of a certain amount. And I think what can be quite difficult is shifting the mindset that actually the reality is even exercise physiologists or dietitians or anyone in that health system that's going to be involved in implementing that intervention may or may not do all of it. So what's going out is already modified before you even got to then the target population, and what they do with it's modified and change. And so that's the element of fidelity for me there. It can be a bit of a perspective of letting go a bit of like releasing that control, especially if it's come from like a randomized controlled trial sort of background. In terms of the sort of design of it, is we often will run trials where we'll just let the intervention sort of somewhat go out, and we'll just capture what happens. So we provide, this is what we think is the best amount to do of it. This is the components of the intervention. This is what we would encourage is at a minimum, you may be doing the training and offering a certain amount of something, but often you don't always know. That hasn't actually been figured out in the trials anyway. And then we leave it pragmatically to see how much people do and how the intervention gets scaled. What are the dissemination pathways? And it's very sort of retrospectively evaluated like that. And then you can look at, well, which one, did anyone lead to a better outcome? That's very much more, I think, designing with, it can be more towards a systems perspective, because in those instances, there can be a better understanding of the system you might be trying to influence. It could be a health system, it could be the education system, it could be, a combination of all of those. But often in just my experience, the trials or the interventions that go in that latter sort of approach are usually by teams that understand that actually this is beyond our control. It shouldn't be within our control. We don't know that we believe in fidelity per se. We just want to understand what gets done and how it leads to an outcome. And we understand that in order for it to be sustainable within the system, it actually needs to become appealing and being able to be embedded and delivered in a way that actually accommodates the existing structure of that health system or education system. Now, the challenges with that, whilst it can make something much more likely to be ongoing and require less researcher support, because usually in that process you then got buy-in from key people along the way, like people that have power, that have money to fund these things. So that's really great, and it's all great for sustainability. It can be difficult to show those hard impact outcomes that you then might need to get more research money. So there can be difficulty there from the data collect, like a really pragmatic data collection perspective. That can be more difficult. It can also be more difficult to then be able to consolidate what is an ideal implementation of this particular intervention then, because the envy, I think, is then of those more traditional randomized control trials where it can be quite explicit. You need to do a certain amount. However, when you're allowing something to be more dynamic and let it evolve within a system, that can be much more difficult. So there are trade-offs, I think, that we haven't yet resolved in terms of measurement and things at a population level with scaling that we're not very good at yet. But in saying that, whilst it's frustrating sometimes as a scientist, if you're trying to do a review, for example, and pull down this data to try and make some sense of it, and then you find there isn't much data, or it's not well evaluated, or it's not evaluated at all. If you were to put that aside and say, well, it's still going, and it's actually been sustained for maybe 5 to 10 years, and it's still being implemented because it's been allowed to just evolve into whatever was needed, is that better or worse? I don't know. I think that's just, everyone's probably got an individual perspective on that. But that's, I think, sometimes designing with more of a systems perspective is allowing a bit more of letting go of that control, which can be quite difficult because it's not how we're trained.
I mean, there's so much in what you just said. I mean,
that was a long answer.
No, but that's why I wanted it to come on. That's just a brilliant answer. It's a brilliant answer. And it's very confirming for me. I mean, I don't know about other people, but um, like I said to you, I think before we were recording, like the Yorkshire Humber Art, we're very applied, and we're not, we work with universities, but our main base isn't a university. We're actually next to a hospital. And so we really feel what the needs of practice are. We know
Yeah.
that these systems are struggling, and you know that the old, an RCT isn't generally going to help the matron on the ward or the doctor know how to implement this thing, because you'd be
Correct.
controlling for all those factors. It sounds like I've read, Trish Greenhouse talk about case study approaches, and it sounds a bit like what you were just describing. Kind of um, giving them something and watching what happens and learning from that.
Yeah.
But
Yeah.
what was really interesting about your answer also was that you talked about some of the downsides, and I'll be honest, I haven't really thought about those so much, because I'm just been thinking, gee, to help practice, what's going to help practice, and actually, but you're right, there are some downsides, and we've struggled, we really struggle to show impact as well, because it's so convoluted,
Yeah.
and I see people trying things like ripple effect mapping, but I don't
Yeah.
know, I don't even know what funders think of that really. So
Yeah. I think I say it because of just I guess my first role when I came back from working in NHS was to be an implementation scientist sort of consultant. So you'd almost my role was to have academics maybe work with me on they have this particular program and they want implementation advice. And so I think you'd get such a spectrum of trials and individual academics with their own different beliefs and so on that I think that's where it's possibly easier to be removed, because I'm not sort of wedded to any one intervention. I know interventions and programs can become the baby of the person that sort of first developed them, and it can be quite difficult to see the wood for the trees in those sort of situations where I think if you're sort of emotionally unconnected to any of them, it can be easier to see it a bit more objectively. But I think there's trade-offs to all of it. And even with the systems approach to scaling, like I always make it clear in any talk I ever do, we don't have good robust evidence that it leads to any better outcomes than not taking it. That's not, that's not what I'm sort of trying to say. All I'm saying is another way of looking at it, and it might be useful and it could be helpful. It's a different way. And these are the reasons that I'll argue why I think it's a useful way. But we don't know it leads to a better thing, because just capturing that's very difficult. But it's hard. And I often wrestle with the idea of, is it better to have something being done and we don't have the perfect measures and we don't have um in good data collection than the perfect thing that's done in a very small population that's controlled? And what do we really gain and lose from both of those approaches? But like
yeah,
I say, I think I said before about us being in an academic system and how we're part of this, but I think because I've had this role where I speak with so many different academics, I've never met one that hasn't been like they've really their sole purpose is to improve the outcomes of individuals. Like none of them were. They might have their own as career aspirations, but they're 100% just wanting to improve people's lives. But they're bound by their own system that they have to work in, and that I currently think is completely contradictory to what a systems approach really requires, with sort of scaling and a lot of health behavior change. So people are tied in it, and so until we have funding systems, I think that possibly allow that a slightly messier way of doing research, and perhaps there's a lot I wouldn't be qualified to unpack all that, but it's going to be difficult, I think, to do things differently in a lot of scaling and intervention implementation at a big scale, like at big country level scale. I'm talking here. I think it's going to be challenging.
yeah. Because I was thinking, there's been a bit of talk about a trial for mindfulness in schools, because that was one of the first things I ever worked on as a researcher, and everyone was very excited about mindfulness, because it was the first time, as psychologists say, it was the first time you had to experience it yourself before you could deliver it
Right.
to a patient, and so people were meditating, and it actually affected them, some of them quite fundamentally, And so then there was a lot of passion behind this, and it led eventually, after many years, they had the Myriad trial, where they tried to roll mindfulness out across many different schools in the UK, and it was shown to not be effective. And they actually, according to the, again, I'm not an expert on Myriad, but from what I can tell, according to the kind of outcomes and the goals they set in the trial, they reached their implementation goals. They delivered it
Yes.
this much and these places, and so that was all ticked, but it wasn't effective. And some of the reactions have been interesting because the funder is now a bit more reluctant apparently to fund whole school interventions, and they're looking more at targeted. And some people think, well, it clearly just doesn't work. But there's not a lot of talking about, well, what if what if we needed to look at the systems of the school first and maybe reconfigure those? Because
yes,
from my experience, they're just as have just as limited absorptive capacity than the health system.
Yeah.
Similar, the staff are burnt out. Head teachers, particularly teachers, taking time off. So this idea that we can just deliver it according to a certain set of things, and I think that needs looking at more.
Yes.
But I agree, it's a difficult thing to look at, and so yeah.
I think it kind of like what you're just saying, it touches on like a conversation I don't think we're having is around when we shouldn't scale and what shouldn't be scaled, and that do we always have to scale for that exact reason? I mean, there's only so many things that can get scaled up. There's only so many things that like a school or a health server can keep or even a decision maker can allocate funding to. It's only going to be reshifted from somewhere else. But we definitely come from the platform of well, this has worked, so it's got to go out. We've got to get that. It's got to be to more people. And I think I don't know if we're there yet, but it'd be interesting to see what contribution this sort of incessant need to scale everything actually contributes to the lack of our ability to scale anything, because we're overburdening and sort of so many asks, everything requires scaling, and it doesn't and it can't be. And so perhaps rather than a sort of pursuing the sort of innovation and novelty all the time, that what would be really innovative would be something that was already existing and has been quite good and had some good effects, that we can get that out more and sustained, but rather than recreating new things all the time, that would be quite innovative. But it's not really what we're doing. So I don't know the answers to those, but it does worry me a little bit that scaling is very much seen as a positive when it actually can widen inequities. It's not always a good thing. We don't know anything about, well, I shouldn't say don't know anything because I've not looked into it, but there's not much written about downscaling and what that involves. So I feel like that will probably be the next, the future waves of study will be getting things back down and, what we shouldn't scale. I don't know.
Yeah, I agree. I had someone else on the podcast talking about how we see risk and patient safety, and again that we often apply a kind of mechanistic, logical model to that. So, something goes wrong, we'll put a thing in place to stop it going wrong again. So now there's an audit for the nurse to fill out, or a check sheet to fill out, and we do this again and again and again, and then eventually when another complex, so completely unpredictable problem arises, no one can respond to it because they're so bogged down with everything else. All these, and that they no longer really have any time for the patient, the human face to face with the patient. And so I think agree with you. I do wonder if a decluttering or kind of
that's a good way.
Let's make some slack in these systems. Wouldn't that be wonderful? So if the health system wasn't at 110% anymore and was at 80, you could upscale as probably quite a few things. So I know. I also, it made me think when we were talking that. Have you seen those interventions that do upscale, but they tend to just do it on their own? They become like a social movement. One example is safety huddles. That was something we did in West Yorkshire a while ago, and it started in one ward, and it was just, we'll just club up, you'll meet together for 5 minutes and just discuss fall risk on the ward, and they just did it 5 minutes a day, and then it started to reduce falls, right, and so then it just spread. It upscaled itself.
Yeah.
That's interesting, isn't it? It's a social thing, So.
Do you think that was because it was developed on the ground in amongst where it was, due to exist?
Well, you absolutely. It definitely, that's part of it. Like you said this before, as we touched on before, helping people make it their own really helps. But then they also need to have the time to then problem solve and optimize it over time, which they don't have. And then
Yes.
then the next thing is funders, all the other parts of the system then need to kind of allow it. And if
Yes.
that's where you hit those barriers. And as you say, we have hardly any understanding really or inroads into policy.
Yes.
So, but yeah, that definitely helped. And it's in last time I looked, 350 plus wards, and
Wow.
and they learn more and more about how to do it. So, you don't need a really senior person to run it. It doesn't work in smaller wards because they don't really need it. It's good in bigger wards. It doesn't need to. It can work for more than just falls. It can be other things. So yeah, that social kind of things. And if mindfulness became a social thing in schools, it probably would just upscale itself. I mean, I don't know
Yeah.
what it would look like, and it would look different. I mean, that was the thing about Penelope Hoare. I love that she would say, fidelity to function, not form. So it can look very different in each school. That's fine. As long as the function's the same. And that's
Correct. Yes. Yeah. We've often said about you scaling the principles of something. You're not scaling components of things. It's the principles of what you're ultimately trying to achieve. And whatever that looks like might be quite different. But if you're trying to, whatever the principle of to get to that change, it's in a behavior or an outcome, whatever, that's the principles that you're scaling. And in that like same vein, it's about the function. It's I don't know that we do this very well, but I sort of firmly believe that, even with like the example of your mindfulness intervention or any intervention, it's not that in and of itself might be being scaled, but you're scaling like conversations about it. You're scaling that people recognize it's a good thing. You've got to scale that people even see it as an issue. Like you're scaling like everything that sits around it that's sort of almost invisible to the thing. That has to be scaled too. And will need to change. So I don't know that we're so good at that yet. Certainly in our prospective planning for scaling, I think we pull that out when we do these sort of evaluations over time. But from the offset, I don't know that's how we can conceptualize scaling anyway.
Yeah. So you're talking about the relational aspect of it, Yeah.
The sort of invisible factor.
Invisible. Yeah. I was going to just say that. Yeah. You can't see it, but it's like it's so important. Yeah.
And that's where I think the systems, like I've just found systems analysis methods can be very useful at drawing that out because qual data, provide this fabulously rich information. But when we've tried to then connect what people are saying, that's where we've found you can actually draw out what are the invisible elements you have to scale, as well as 5 training sessions and 4 modules, the really, that invisible stuff's far more important for the long-term scaling and likelihood of something getting up. And that's because they directly link to those gatekeeper, issues or those real like non-negotiable barriers, because it's just the perception of individuals who are like, yeah, no, I don't want to do that. I haven't got time. It's not of value. So really important. Programs where that sort of happened, where they've really managed to latch on to an external body from a university where they were developed in. I'm trying to think of some good examples, but without oversimplifying it, it's usually linked to a very supportive champion of it in an individual that really believes in it and really pushes it through. So that's sort of almost like a non-negotiable to get something to begin that scaling process, where it then gets that natural buy-in, I guess.
That's probably what they'd call the system convener, that person.
Yes. Yeah. Quite possibly. And they're not always the one you think as well either. I think it's we have to be realistic about how we do things. And sometimes you do need to look at an organizational structure and say, okay, well, this is the obvious job role of somebody that has to make the call about a decision like this, of whether do we allocate, $500,000 to X. That's going to land on the lap of that particular individual. But it's other people around it who around that individual or just within that particular organization actually can have a really integral role. And just from the work we do in our institute, these are relationships that the institute's had for more than 10 years, like 20 years. So they're really well-known individuals and really like genuine trusting relationships between them. So I think it's probably possibly what Alison was saying, that you really can't undermine the importance of that. And that even came up at the implementation conference so much about the trust element. Um, I don't know that there's it guarantees any sort of let's say success if you're trying to get something to scale or to be implemented. We've certainly had situations where that individual changes, they move job roles. There's often a lot of turnover in some of these organizations. Individuals get moved around within it. That can be really problematic, but it's certainly been critical because they have a power that we external we just simply don't have. And that's where I think that type of thing carries far more weight in many regards to the gold standard of our evidence. So we all come with a different understanding of what value evidence and different types of evidence has. But
Yes.
yeah, for sure, I think it's the relationships there.
You talked about the sort of the sort of area of the system that academics find themselves in, and how it's very much almost working against them to do something in a different way like this. But I also you've worked in the NHS, so you'll know that the sort of challenges faced by people on the ground that so busy just doing things that to actually keep track of and plan implementation, keep track of it and upscaling too, that's very difficult for them. They have barely any time to, like I said before, the problem solve when issues come. And so it feels like everybody's it's difficult for everyone really to do anything differently. And so I wonder if we all parts of the system need to evolve with this kind of evolve our thinking a little bit. And I wonder if that's kind of the history of science, is probably lots of paradigm shifts every however many years. And I wonder if we're kind of heading towards that now, because it's not with everyone. I mean, everyone is really trying. There's no question about that. It's just these systems are struggling now a lot for lots of reasons, but I just think that's also going to push us to probably a paradigm shift of some sort, I think. Yeah.
I mean, I don't know if it's in your in your experiences where you're working, but I know certainly over here in Australia, like we are regularly getting individuals who are working in governance saying they want to take more of a systems perspective. They know that these random acts of doing things is not the way, but they want that upskilling and they want the capacity building in it. So certainly in a practitioner perspective and a government perspective, I experience that has shifted. Whether that's going across all different, whether it's in everywhere, I'm not sure, but I think we could be on the cusp of a real opportunity, because it's one thing for us to be preaching, but if you're preaching to the converted, you're halfway there.
We kind of keep going off on little threads, but that's okay. I think that's good and I just trying to, because I know people listening, a lot of people listen to this podcast, I think often they want to use something as something in their approach, in their methods. They want to know what can I. So we've talked about, I think this is great. I like this, that you do this, but approaching people in the system and doing some qualitative work, and you're understanding and you're mapping that out. Is there anything else that you would recommend people try, or any tools online or papers?
Yes. I think firstly, probably identify what you don't know. So if it's just you're not really understanding what systems thinking is, I would conceptually try and immerse yourself in some reading around that. So just so you're understanding what you can and can't achieve, because sometimes I think systems approaches can be seen to be, they get used so widely, the terminology gets used a lot, and some methods can be seen to be predictive, almost like dynamic modeling sometimes I think can be perceived that they can sort of predict what might happen, which isn't the case. So I think a good understanding of that to start with will probably help guide where you might go next. The one thing I always do is I always collaborate with someone that has far more knowledge than me. So a system scientist, if they're in house, that's a bonus, but they have such a different take on the problems that we're facing, that even if you maybe understand that systems might be important, a system scientist is really grounded and trained in all the different methods and models. It's just a phenomenally different, more scientific approach to doing it. So I think that's really, really important. I don't I'm not in a position to change a system, and I think most of us probably aren't. We're all just part of it, trying to contribute. I think if you're sort of wanting to take an entry level into it, at least doing some methodology, or that's a good way to start. Where you may be still collecting data in a traditional way that you're comfortable with, and still within what your project maybe is intended to do, or what your skill set is, but then doing a different type of analysis. That's where I think even that can be hugely insightful. And we often use like the group model building, where we're getting it, stakeholders together in a room. The process of doing that is often far more valuable than the map that comes out of it for them as well. So it sort of doubles up as a real networking opportunity for them, and they can see where they are in the system. So I think methodologically, there's small things that you can do that you maybe don't need to be an expert for, but trying to get connected to somebody that has system science expertise is invaluable, I would say.
It sounds, Harry, it sounds like you are quite comfortable with the idea that you or actually help these systems, you facilitate scale in or implementation in them through the methods you use. So you just said them talking to all these people, that actual process is helpful. Is that true? Is that
Yeah, I think so, because I think we can, all of us can be guilty of thinking that the problems are outside of us, that because we maybe have an awareness of them, that it's like, oh, it's because they don't fund this, or people change, it's always external to us, and we don't often, it's going to be hard. I think we're all human. We don't often see our place within that problem and how we're contributing or helping it as well. It's not all negative. It can go both ways. And I just find it really valuable that when you have a group of individuals in the room that are in it, they are living in it, making decisions about it, trying to do change. So not us externally maybe studying the problem, but working in it. Them being able to see why they maybe find it difficult to get traction can be also almost like forgiving, that everyone's doing their best, and that there are some things that just cause these changes to become so difficult, but also where they maybe are in a situation where they're contributing to it, not because of who they are, but because of their role or because of other things. So it's seeing ourselves within the system we're working in as well. We're not outside of it, and remembering that. So I find that really valuable in terms of, yes, you might get an output from it that's sort of data that can then be used to do more on other things, but just follow-up conversations I've had with individuals who've been in that process, they've then made different decisions in their day-to-day jobs, or they've decided to go and work with, I can't think of tangible examples, but it's had a repercussion on them because they've understood where their place is. And I think, no, we don't traditionally get involved in those conversations in our day-to-day working lives. It's not how we're organizationally set up to do that. We don't have the space to just sit around and all talk about something like that. So that can be extremely powerful. And there's lots of papers that have said that the process can lead to more value than the map. The map's an output and can be a tool for other things, but visualizing where you are in it. And also, it can be quite powerful for individuals as well to realize that the map, particularly obviously the qualitative ones, they're the mental models of your perspectives of the system, right? So if you have different people in a room, you'd have a different map. And if you ask them at a different time, you'd get a different map. So it's not, this isn't the system and this is how it is. This is just what that reflection was at that time with those individuals there. And that can be a bit freeing as well for people, I think. So yeah, a long answer to a short question, but there's huge value in it. So even if you need to get an external person to come in and maybe facilitate a group, that, and you don't need to do it yourself, but hugely valuable.
How do you see these approaches evolving? Do you think, you said Australia sort of, it sounds like it's becoming more of the kind of conversation across the board.
Yeah.
Do you think it's going to evolve further?
I definitely look in my small world. I think it's conversations are becoming more commonplace. Same with implementation science. I think we have it more explicit in all our funding schemes in academia, and so it takes time, but this starts to become more explicit. I think until it's hard. I know people disagree on this. And I've had different conversations where some have said, oh, we have really good guidance of how to do systems approaches and so on. It's still a perceived barrier, whether it's an actual barrier in terms of having tools to operationalize this. I I don't know, but I would definitely say there's a perception that that's a barrier. And so I can certainly say from scaling, like there isn't good guidance on how you do that. And it's something we're trying to work on. But I sort of wonder that we could end up in a bit of a sort of a paralysis where we might all agree, yeah, it sounds great. The concepts of it all good, and we can all talk about these things, but the actual, so how do we actually operate and make a change? I think that could be that roadblock that we just keep hitting up against. That's where I feel it a bit now, is certainly in conversation with, this our colleagues who work in state governments are definitely supportive of the idea of thinking in systems. They understand health problems are much bigger than individual things, but they really struggle to actually make change because above them there's lots of layers where that isn't the perspective. So I think it's really positive that it's certainly our perspectives have shifted in that way. These things can take a really long time to change. And I think COVID in a way was a really opportunity. It was an opportunity there where it really amplified the whole system perspective of how these things, the consequences of them, but also our responses and how we then dealt with changing different things in our environment in response to COVID. So that I think's been quite powerful in people's perspectives. Whether it's actually led to sustainable changes in behaviours and decisions, I wouldn't be able to say, but I think it's, implementation science, sort of, as you said earlier, has kind of went the other direction where we've really delved into the studying of it, but to the extent that anything's implemented more, but we know a lot more. So we don't want the same to happen. Wouldn't want the same to happen to scaling, but yeah, it'll be interesting to see.
It could just become it could get reduced down to a series of steps and kind of all the
possibly.
Yeah. I like how you
study it to death.
Oh, you study it, you define it, you can say problems are problem analysis, but
yeah,
how do you actually bring it about? Yeah, not great. I mean, I'm sure that requires practical knowledge by doing. And so somebody, don't know who, but someone in the system needs to sorry, I've already made the mistake, have I? But all of us probably together in some way need to go and try and do it again and again and again. And it's through that process. And it might be very hard to show that process.
Yes.
Have the metrics at the end. Yes, the depression decreased at the end, but that's how we learn. I mean, that's how we learn. I speak, I spoke to a doctor GP last week, and it was like, she just knows how to get things done in her practice because she's been doing it for 20 years. But it's quite hard to get that down into a research paper and, share it. I was going to say, I really like how you talk about perceptions because I interviewed someone called Harvey Mailer, who helped develop the NAS CAP tools, the non-adoption, oh my God, non-adoption spreads, scale up sustainability framework. Probably said that wrong. But the framework about I really like that framework. I was really excited about that. But he was saying it doesn't actually matter we're not trying to find an absolute, this is simple, complicated, complex. It's about people's perceptions of what is complicated, what is complex. The perceptions are really important because that will affect what happens. Yeah. I mean, what I'm trying to do at the moment, I don't know what your thoughts are, but in real time, so there's say, I don't know, there's an ICB, some hospitals trying to implement something, and I'll also say, well, I'll help you evaluate how this goes. Again, it's kind of like a real world case study because we allow them to try, and then I'm trying to capture what happens, and capture all the different parts of how they're interacting, and we use methods like we use rapid qualitative analysis a lot because that again develops that relationship. It's useful for them. They get a report of how things are going. But I'm also using NAS, and what I'm trying to do is with them is identify as they're trying to implement, where does the complexity lie? Can we reduce it in real time? Right? Not at the end to say what the complexity is, but trying to actually help them do it. And that my theory is that if we get really good at that, they might actually be more successful, and we might learn more about how to upscale things or how to implement things. But I don't know.
Yeah, no, absolutely. No. I agree. There's a concept in more the agriculture literature about dynamic scaling, and it's this like sort of what you described. It's like iteratively, like evaluation and learning and doing as you go. And no, 100%. I think that's it's. I don't think we don't really do. I don't think we're doing that a lot. Like it's not routine in how we deal with scaling. But no, for sure, because I think there was a really successful like system-wide transformation like a long time ago. It was in Denver Health that they did a system redesign, and one of they would have that could be described as a systems approach to scaling. And one of the really important elements of what they followed was that they had this embedded like monitoring and feedback about system changes as they were scaling, as they were doing it. And so they had this real-time feedback and they could change as they were going along. And they really understood like the historical behaviors when they've tried to change the health system in the past, and the kind of antecedent behaviors. They understood that. So that meant that they could foresee any like potential blockages with stakeholders and they could overcome them. But it was paramount. That was all built in from the start. So they really understood their health system and how to change it. But that, that paper, I think it was by, I wouldn't be able to remember, Harrison, maybe 2009. But that's a really good example of what you're sort of talking about. But yeah.
Oh, fantastic. Harriet, I think we've probably, really harnessed this for a while.
I think
Anything else you want to add? Please.
I think it's not wanting to risk falling into the same trap of sort of criticizing existing scaling of being oversimplified, and then sort of introducing like a systems approach to scaling and then reducing that to be super simplified. I think there's a huge amount we still have to figure out with what that looks like, how we do it, what the pitfalls of doing it, and what's really good about. So yeah, I think it's just such an unstudied area, I think. Anyway, there's just so few academics that are dedicated to studying just scaling. So at risk of oversimplifying, that's what we don't want to happen, is to just be using another set of terms to finish a paper, to comprehend systems. You can't, we can't. That's why we have these methods of putting things in, mapping it out, because we can't actually fully conceptualize all those interacting parts. Like it's impossible to be able to do that. And we all are completely biased by our own experiences and perspectives and what we're bringing with us. So I don't think we should be too hard on ourselves that we struggle with a lot of this, because we're all limited and flawed individuals as well, trying to make changes. So I think it's understanding that we're all sort of flawed in that respect, but have a common agenda, and that's the common ground, I guess.